Hi there, this is Dr. Funke Apalabi Brown, the founder of Restful Sleep MD. And so in this video, we're going to be talking about the treatment of obstructive sleep apnea. My previous videos, I talked about the symptoms of obstructive sleep apnea in kids, as well as how sleep apnea is diagnosed. And so now you have a child who has undergone what you call a sleep study or a polysomnogram, and your doctor says they do need treatment for their sleep apnea. And so really, I just want to take us through the different modalities of treatment of sleep apnea. But to start, I think I would like to talk about what are the common causes of sleep apnea in kids. In younger children, remember we talked about the fact that sleep apnea can occur in infants all the way to adolescents. So in the younger children, especially within the infancy and less than 2 years of age, you can have obstructive sleep apnea due to enlarged tonsils and adenoids, but also due to what you call craniofacial abnormalities. So some of the time, these children may have small jaws, or they may have situations where their tone is low, so like in children with Down syndrome, and because of that, their upper airway collapses. And so that's one group. The most common cause is enlarged tonsils and adenoids, and you'll see that all the way to adolescence. Another common cause of sleep apnea you would see is obesity and being overweight. So we'll see that more in our older children, but now because of the obesity pandemic, we're seeing this more in even younger children. And so based on those different kind of causes and risk factors, we'll talk about the different treatment options. The most common way by which obstructive sleep apnea is treated in children is what you call adenotonsillectomy, where you remove their tonsils and adenoids. The tonsils are just some tissue that's behind the throat, and then the adenoids are enlarged tissues, could be enlarged and occur right behind the nose. So those tissue tends to get big and can cause obstructive sleep apnea in kids, and the most common way to treat this is by removal. Usually this is done by a doctor called the ear, nose, and throat doctor or otorhinolaryngologist. And so this is very definitive way of treating and tends to resolve in about 80 to 85% of children. That tends to resolve the obstructive sleep apnea. In a smaller group of children, it may still persist, and then they'll need different other modalities of treatment. The second treatment option for obstructive sleep apnea in kids is what you call CPAP, or continuous positive airway pressure. And essentially what this is a steady stream of air that is pushed to the back of the throat using a mask, usually a face mask or a nose mask that's connected to a tubing and a compressor, essentially. So it's not oxygen. Essentially, all it does is it just pushes air to the back of the throat so that the child's throat remains open during sleep, and then they're able to eliminate the obstructive sleep apnea as they sleep. This tends to take some getting used to, but with the appropriate behavioral strategies and the supports in place, we're able to get children to tolerate CPAP really, really well. A third way of treatment in some situations, especially if the obstructive sleep apnea is not very severe, if it's more on the milder stage, sometimes we'll treat with medications. These medications include things like a nasal steroid spray. Usually if you have a child who has allergies, significant allergies that may be contributing to their sleep apnea, we'll use that as an option. Again, assuming that the sleep apnea is on the milder side. Then another method of treating obstructive sleep apnea is weight loss. So if you have a child who is really overweight and we feel like the weight is contributing to their sleep apnea, weight loss is recommended. Of course, that's going to take some time. So while they're achieving that weight loss, the important thing is that you're treating it. So whether they get surgery or they get CPAP or something, so that's important to put in place as they achieve their goal weight. Studies have shown that with weight loss, sleep apnea does improve both in adults as well as in children. And then the last I would say is watchful waiting. So usually for a small group of children who have the more milder forms of sleep apnea and they don't have too many daytime manifestations, at times that could be an option where we cannot wait, and over time they may outgrow the sleep apnea. Of all these methods, regardless of the treatment modality, the important thing is to make sure that your child gets reevaluated. So if they have these symptoms of snoring and a lot of daytime issues, and after surgery it's gone, or with CPAP things are better, or you feel like things are better with medication, regardless of that, they should be reevaluated. Sometimes they may need to get another sleep study, especially if you're doing the watchful waiting or the weight loss, where you're really not sure where things are. It's important that they get a repeat sleep study to just make sure that their obstructive sleep apnea has resolved. And then also, of course, if you put a child, if your child ends up needing CPAP, usually what will happen is they'll come back to the sleep lab and get what you call a titration study. And that study really will help us to see if their sleep apnea is adequately treated, if they need some more pressure or not. And those are just some reminders. Again, is circling back, discussing with your physician and the sleep doctor to make sure that the sleep study is included again, just to reevaluate, especially if the symptoms are not completely gone. So one other small group that I should have mentioned actually earlier in terms of surgery, for some of the children that have a crowded jaw, maybe they have a smaller jaw and they have a crowded upper airway, sometimes we'll do surgery actually to open up their jaw, to increase the space in their upper airway. So this is done by, it really should be done in a hospital that has that expertise, but that's a small group that we'll see sometimes. And so we've gone over the different options for treating sleep apnea in kids, including surgery to adenotonsillectomy to remove the tonsils and adenoids, including using the CPAP, which is the pressure that keeps the airway open. We've talked about some medications, especially in children who may have allergies that are contributing to their sleep apnea. Then we talked about weight loss and potentially watchful waiting. Again, this all has to be done in consultation with your doctor, and who by now will probably refer you to an accredited sleep center for this treatment options. So I hope this has been helpful. I would love it if you like this video, if you share and subscribe to my YouTube channel, so that way when new content comes in, you'll be the first to know. Remember, I am a physician, but I'm not your child's physician. So the information I'm giving you is really for educational purposes. If you have any concerns your child has sleep apnea or any other medical sleep problem, then definitely speak with your child's physician. Until next time, I hope you rest well.